The Delta variant is the main reason the easing of COVID restrictions in England has been pushed back. Here's what's happening to the daily number of cases, and most of them are Delta. Well, this is what we know about it. First, symptoms. This app, called Zoe, tracks people's experiences of COVID, and they're changing.
And they're not the same as they were. So the number one symptom is headache, and then followed by sore throat, runny nose, and fever.
A fever is still common, a loss of taste and smell less so than previously, and a cough much less so. And we're told not to be surprised by the fact COVID now shares symptoms with the common cold. And these shared symptoms with colds, well, that's causing concern that people may not realise they have COVID. To counter that, in the US, this is updated advice listing a runny nose and a headache as symptoms to watch out for. The UK symptoms list hasn't been changed yet, but the UK government is talking about Delta's transmissibility and the severity of illness that it causes.
Delta variant now accounts for over 90% of cases across the country. We know the Delta variant spreads more easily, and there's evidence that the risk of hospitalization is higher than for the previously dominant Alpha variant. 2 doses of the vaccine are just as effective against hospital admission with the Delta variant compared to the Alpha variant.
UK data backs this up. We know the Delta variant is around 60% more transmissible than the Alpha variant, or the Kent variant as it's also known. Hospital admission rates suggest people infected by Delta are twice as likely to be hospitalised than with Alpha. Now, we should also emphasise overall numbers are low compared with earlier this year, but this high transmissibility, well, that helps to explain what's happening in the UK. These are recent case numbers, and the highest rise is among people in their 20s, and they're the adults most likely to not have been vaccinated. And that's one of the reasons that, having looked across all the data, my colleague Robert Cuff reached this conclusion.
The picture is emerging. It is more transmissible, it's more severe, but it does blunt the vaccines a little bit, but they still do work. So that's the overall picture of where we are now.